We're very, we're very happy and thrilled to have Dr. John Lewis returning to talk with us. And Dr. Lewis is the founder and president of Dr. Lewis Nutrition. He's a voluntary associate professor in the Department of Family Medicine and Community Health at the University of Miami Miller School of Medicine. He's a diplomat and faculty member and advisor of the Medical Wellness Association. Dr. Lewis has been the principal investigator of over 30 different studies, and he has raised over $23 million in grants, gifts, and contracts for research studies and clinical trials and education programs. Much of his research has focused on evaluating the effects of nutrition, dietary supplementation, and exercise. He's been an invited speaker at multiple international national conferences and was selected for a widely acclaimed TEDx Miami talk, which you can find on the internet, about how dietary supplementation can improve brain health. Dr. Lewis has over 180 peer-reviewed publications in some of the world's leading scientific journals. And he embodies the model of health and wellness himself by eating a whole food, plant-based diet for over 27 years, taking certain key dietary supplements and through a rigorous daily exercise training program. And so without further ado, I introduce you to Dr. John Lewis.
Thank you, Dr. Redwine. It's a pleasure to be here. I'm going to hopefully share some interesting information with you guys today about polysaccharides that are near and dear to my heart because of all this work that my colleagues and I have done on that topic. Can you guys see that screen okay?
No, I don't see a screen yet.
No?
Do you have sharing capability?
I think I do.
Oh, something, yeah.
Okay. It's always tricky because I have two monitors and oh gosh.
Finding the right one. Yeah, I think if you touch that little screen up in the corner, it'll go to presenter view, all the way to the left and up. It looks like a little screen at the very top one. There you go. That
Did
should
that help?
work, right? No. No, why didn't it work? Usually that works. Um, there's also usually one at the bottom, but I don't see it today.
The heck?
Oh, oh, now we see you again.
I'm sorry, guys. I don't
No
know.
worries.
How's that? Did that work?
No.
No?
I think it's on your other screen.
I didn't have this problem before. I don't know what.
It's always on the day of.
Dr. Lewis, go to your slideshow option on the top links, and then there should be a button that says presenter view.
Hmm. I'm sorry, where did you say to go?
That's okay. Do you see your buttons on the top that says home, insert, draw, etc.?
Yes.
You're going to have an option that says slideshow. Click
Yes.
that, and then it should be like maybe the third or fourth little icon that says presenter view.
No, I don't see it.
Worst where it comes to worst, you can send it to Emily and she can present and then just change slides. I'm just saying, just in case.
Sure.
So all is not lost.
How's that? Did that do it?
No, we still see you. So it must be the other screen.
Are you sharing your screen?
I am.
Go back to the share button and see. Okay.
How's that?
There we go.
Okay, man, that was wow. I just had to disconnect the other monitor. I couldn't figure it out.
Well, it works, whatever works.
All right, well, let's get rolling because I've already wasted five minutes on that. So, again, as I was mentioning, this is about a 20-year journey of my work in these complex sugars with uh, many folks at UM and other institutions around the world. And so, if anybody's interested, just as a point of interest, if you'd like to have a copy of this presentation or any of the articles we published, here are my two primary email addresses. I'm happy to share that. In fact, I had a couple of people from part one ask me for the lecture, so I'm happy to share with that with anybody who would like to have this information. And again, I will acknowledge it. I'm just, as I mentioned to Laura when we were getting ready to start, I'm just going to touch on a couple of the highlights from the first part of this lecture so that if anybody was not here for the first lecture, you'll get, excuse me, what I think are the most important couple of nuggets from that first talk. But Dr. Reg McDaniel, a pathologist by training who I met about 20 years ago. Dr. McDaniel introduced me to his story about polysaccharides from aloe vera and just completely blew my mind. I had no idea what this man was talking about when I met him because, like most people, when you talk about aloe vera, you think of what? You think of a topical, you use the gel for a topical solution for a sunburn or a cut or a wound. And this man's talking to me about using aloe sugars in treatment of cancer and HIV and heart disease and neurodegeneration and on and on and on. And just completely fascinated me and blew me away because it was way more beyond anything that I had learned about saccharides in general, let alone polysaccharides from aloe vera. And so I really owe that man a huge debt because of who I am today and how it changed my life and my career. And then Miss Barbara Kimley, she introduced me to a rice bran product she was taking. She was a patient at Sylvester. And back in those days when Sylvester used to do print publications and they would send their print articles around about survivors, physicians, nurses, staff, donors, et cetera. It was kind of a feel-good publication. I don't think they still do it to my knowledge. But anyway, there was a story in one of the issues about Barbara, and she had, poor thing, had gone through the entire gamut of conventional treatment, surgery, multiple surgeries. I forget how many chemotherapy and radiation treatments she had from the metastatic disease from her thyroid, and went through all of that treatment and was still only given about a 6 month prognosis. So you can imagine how mentally, psychologically devastating that would be to anybody. And she started taking this rice bran product and she ended up living another 9 years. And I got to know pretty well Dr. Wolfson. He's still at UM, the radiation oncologist. He said every time Barbara came into his office for a follow up, he would look at her charts and say, "Barbara, I don't know even know how you're sitting here. You should be dead. Like your values to me suggest you should not even be alive. And so he had to admit it was this rice bran product that ultimately led to us running 3 clinical trials with the rice bran, which I'll talk more about today. But of course, with Barbara and Dr. Reg, this again is where I am today after these nearly 20 years of working on these polysaccharides, and then of course in general all the people and sponsors who've supported the work. I couldn't be here without those folks as well. Generally speaking, I like to start this lecture just by acknowledging what Hippocrates said before our calendar started, let food be thy medicine, because in this case, it truly is the case where you utilize these polysaccharides, unlike just about anything else that Mother Nature provides for us for a healing effect. And it's, again, when you see some of the results, I think you'll be similarly impressed and similarly maybe if you don't think in that concept, maybe it will help you to get there. But again, I mentioned the polysaccharides from rice bran and aloe vera. There are lots of other sources of polysaccharides in Mother Nature, actually, whether it's from Dioscorea, like this Mexican wild yam that's very has a very high polysaccharide content. Lots of vegetables, lots of grains, seaweeds, mushrooms. There are lots of plants that contain these polysaccharides, but the ones that I really have focused on are these two from aloe vera and rice bran, and that's what we'll talk about today. Also, to help set up the context, for me, sugar is one of the most misused words in certainly all of nutrition, if not all of health and wellness, simply because it's always taken out of context. And I know that a lot of times when you hear somebody make a statement, all sugar is bad for you, I hope that they're just actually being, a bit misinformed or maybe even a little bit ignorant as opposed to being completely intellectually dishonest. And the reason I say that is because there are 4 types of sugar in Mother Nature. There are monosaccharides, one molecule of sugar like fructose. There are disaccharides, 2 molecules of sugar like sucrose or white table sugar. There are oligosaccharides, about 8 to 10 molecules of sugar commonly found in breast milk. And then there are polysaccharides, the ones that we've studied. And these things are literally thousands of glucose units attached together by these very sophisticated glycosidic bonds. They are like nothing else in Mother Nature, not even amino acids, fatty acids, certainly vitamins, minerals. None of these other nutrients even come close to the complexity and the density of the coded information contained in these polysaccharides. And again, I'm focused primarily just on the two from rice bran and aloe vera, but it's incredible how much information is contained in these 2 types of nutrients that our genes then take all of that coded library of information and then they guide our cells in how to function. And so this is the reason, or one of the reasons why that Dr. McDaniel and I have discussed over these last many years why these things are so efficacious. And again, it's due to at least partially how much coded information is contained in them. And so circling all the way back to the word sugar, at the end of the day, these are still sugars, carbohydrates, saccharides. These are all generically synonyms. But comparing these polysaccharides to something like fructose or sucrose, which, again, if you're eating a lot of that every day, it's probably not your greatest strategy for metabolic health, but you cannot compare them to even oligosaccharides, let alone polysaccharides. And so, again, it's just for me, as somebody who's very mindful of the use of the language, when somebody makes the statement, all sugar is bad for you, it just it makes my skin crawl because it's taken completely out of context. So I think it's important to put that word sugar in proper context whenever we can. We're really talking about simple sugars that contain the potential to really create metabolic havoc versus the complex sugars that can actually be very beneficial for us. So again, just for the in the respective time, I won't go into too much of this again, but I do want to put out just what I think are a couple of important points to make, and that is, if you look at this graphical representation of basically every cell in the body, I know the mitochondria tends to get a lot of the publicity about its role in our lives and how it's really so key to survival, but yet the other organelles, particularly the endoplasmic reticulum and the Golgi, when they are creating bioactive compounds, they need all of these different, there are about 40 different nutrients, elements, compounds that we need for our cells to function properly beyond oxygen. And so these polysaccharides are very, very important in that process. When those two organelles are talking to each other, they need those polysaccharides in very specific units and amounts. And so this is, again, one of the reasons why these things are just so dynamic, especially when you consume them from something like aloe vera and rice bran. The body's incredible intelligence has the capacity to create from different sugars these polysaccharides when you don't supply them in the diet. But when you do take them from these different food sources, this is again why these things are so efficacious. And so at the end of the day, when a cell is either replicating itself, being surveillant or aware of infection or trauma, something it needs to manage, or it's talking to another cell, all these different cellular activities, it needs those polysaccharides. And so this is one of the reasons why these things are so important. And again, generically speaking, at least in terms of the focus of a lot of our work on immune function and inflammation, we believe that these things actually function as like signaling mechanisms to the immune system. And I'll continue showing you examples of that. Again, I also mentioned one of the earlier comments that Dr. McDaniel made to me, or not comment, but anecdote, was his work with cancer patients. And he had the opportunity with a hospice center in the Dallas area to go in and ask. He got permission from the facility if any of the people there would like to try the polysaccharides and just see what happened. I mean, if you've been sent to hospice already, you're pretty much given up for dead as it is. And so, at that point, unless you don't have any money, what do you have to lose? And so this was a gentleman who, again, went through surgery, much like Barbara's story, surgery, chemo, radiation, the entire 9 yards, the entire spectrum of conventional treatment, still sent to hospice. And then Dr. Reg got to him. You can see on the left this scan of his liver from July of 1999. This was after all of these conventional procedures, got started on the polysaccharides. And then you can see, look at the difference in the size of the tumor over that 1 year period, a pretty dramatic reduction in tumor volume size. And then guess what? Shortly after that, it was, I think maybe within another year, this gentleman actually left hospice cancer free. Now, that is basically, again, from a conventional medical orientation, that's medical heresy, right? Like that's not really something that's supposed to happen. And this is also a good point to make the distinction between the pharmacological paradigm versus the nutritional paradigm. And what do I mean by that? The pharmacological paradigm is essentially taking a chemical, a synthesized material, and then altering a metabolic pathway to treat a symptom of a disease. So in other words, Tylenol, that's the best example. You have a headache, you take Tylenol, something happens 10, 15 minutes later, and your headache pain goes away. The nutritional model is something completely different. The nutritional model is providing the raw materials that the cells need to function properly as guided by our genes. And then through the body's inherent intelligence, it somehow has this ability to repair, restore, and heal itself. And so, again, these are completely different approaches. So please, nobody leave this lecture and say, well, Lewis said you could use nutrition to treat disease. I'm not saying that at all. I'm saying in the case of this gentleman and many other people, the body's intelligence was able to heal itself because it was given the proper materials to do so. And as of the last time I asked Dr. Reg about this man, this was probably either end of 24 or sometime early last year, he was still alive. That's how incredible the power of nutrition is, that this guy was actually sent to die, but because he was given the proper materials to do so, he was able to live and is still living. And of course, is still taking these polysaccharides. Like, why would he not? So that was something for me that was just completely mind blowing and really started to shift my perspective on nutrition. And ultimately, through a connection of Dr. Reg's, we were able to run this Alzheimer's study, which again, I'll probably stop, just checking my time here. I'll probably stop at that point and then shift into the rice bran discussion, since we didn't get to that the last time. So we were able, through the generosity of this one family that had 4 family members die of Alzheimer's disease, and the wife of the husband and wife was listening to Dr. McDaniel give a lecture, and he was talking about some of his work with people with Alzheimer's and Parkinson's. And so she felt very inspired. They formed a relationship with him. And then one thing led to another, and they said, well, we've got some money that uh, we're trying to, find a good place for that from the sale of our business. Sounds like what you're doing would be potentially very beneficial. The only thing we ask you to do is just run the study in people with Alzheimer's disease. And so, Reg, not being affiliated with a university or any kind of research organization at that point, I just happened to be at the right place at the right time. And so we ran this trial of people with moderate to severe Alzheimer's disease. These are the people that are really not candidates for most of the studies in big pharma, in terms of what they're looking for. They don't really typically study people at this advanced severity level. And so we put them on the formula, this Aloe multi-nutrient complex, as we called it generically. And then we put them on there on this particular formula for 12 months. We assessed their cognitive function at baseline, 3, 6, 9, and 12 months. And then we drew their blood at baseline and 12 months due to a limitation of our budget. But we wanted to look at the links between essentially brain function with a proxy cognitive function, of course. It's difficult to assess purely the brain's functioning without several different tools, and then looking at what was happening at the cellular level, primarily again in the immune system, and then some inflammatory markers. So the next graph here, and I'm sure some of you are familiar with the ADAS-Cog if you don't use it in your practice, or you've at least heard of it being associated with the university. This is the gold standard for assessing cognitive function, especially in people with any type of dementia. And that's not my opinion. That's stated in the scientific literature. If you're not familiar, you might be thinking to yourself, well, wait a minute, John, the score is going down over the 12-month period. In this case, you want the score to go down if you're hoping for benefit. The ADAS-Cog goes from a 70, which is like basically your desk or a table. You have no cognitive function whatsoever, to a 0, which means you have perfect cognitive function. So, folks, look at what happened here. I mean, again, for me, this was like one of the most rewarding moments, not only of my career, but my entire life in terms of showing something that could actually help people. By the way, this is the sixth leading killer of Americans now, if you don't know, in terms of what Alzheimer's is doing to us, with about 6 to 6.5 million Americans with this tragic disease. So over the 12-month period, there was a non-statistical decrease of function at 3 months. Again, it was not statistically significant. But at 9 and 12 months, we showed clinically and statistically significant improvement in cognitive function according to the ADAS-Cog. You can compare that. Please fact check me, because I like to suggest to people to do this all the time. I am not aware of anything else in the literature in this particular patient population, whether it's certainly not the 5 FDA approved drugs for dementia, they don't do this. Any type of diet, any other dietary supplement, exercise, hyperbaric oxygen, red light therapy, acupuncture, cognitive behavioral therapy, music, sound therapy, homeopathy, you name it. I have not seen any other paper in people with moderate to severe Alzheimer's disease showing an improvement in cognitive function at 9 and 12 months on a dietary supplement. And to make sure we're clear, just for those of you who may not be completely knowledgeable about statistics, there's a definite distinction between something clinically significant and statistically significant. So what do we mean by that? Well, the law of large numbers says if you have hundreds or thousands of subjects or assessments or time points in your study, just by complete chance, just by randomness, you're going to show statistical significance at some point in your analyses. Would that necessarily mean, though, that it had any relevance or any practical value? Not necessarily. When something's clinically significant, and again, this is not my opinion, this is what the literature says, on the ADAS-Cog, if you have a change in your score of 4 points or more, good or bad, in this case, 4 points better in both time points, that is deemed to be clinically significant. In other words, practically meaningful to the person. So it was just for me like such a rewarding thing to find this. And of course, we were beyond thrilled as we were analyzing the data. And then just finally, really quickly, at the cellular level, we showed a really nice statistically significant improvement in the CD4 to CD8 ratio. That is your ratio of your helper cells to your cytotoxic cells. that's important for all of us, not just people with Alzheimer's, especially as we cross middle age. We want our immune system to be regulated as much as we can. And then with TNF alpha and VEGF, it was interesting that we noted there were really no other studies, especially in response to a nutrition intervention, showing that we could lower inflammation according to these two proteins compared to all the research out there on heart disease and cancer, which is commonly where those two inflammatory markers have been studied the most. And then finally, the CD14 cell. This is a type of adult stem cell that we know from other research, not from This was from, I believe, a laboratory in California. I have to double check where that was, but they showed that CD14s can migrate and turn into neurons. So look at what happened here. There was almost a 300% increase in those CD14 cells, which again, our working theory is that they were migrating to the brain and turning into neurons, which we now know neuroplasticity being commonly accepted as opposed to whatever 20 or 30 years ago, no one believed that. And so when you look at all these physiological cellular changes to support what happened at the clinical practical level, it was really powerful. And then this was our just from our first paper of the 4 that we've published. Was the only paper in my career where I submitted this paper to be accepted for publication or to be published. And I actually got a phone call from the editor. He's still the same editor today, Dr. George Perry. He called me up and he said, "Wow, Dr. Lewis, this paper is really nice. I'm going to recommend that we publish this as soon as I get the reviews back from the reviewers." I'd never had that happen in my entire career, either before or after. And so that was a really nice little point for me. But anyway, all of these findings from this first batch of analyses, not even counting from the other 3 papers, were just really exciting for me and really life altering. So with all that said, I'll skip all the rest of the information. And again, for anybody who's interested, I'm happy to not only share with you this lecture, but these presentations. So I'm sorry, these articles. So we published, just in summary, we published 4 papers from the Alzheimer's study and 3 papers from the multiple sclerosis study, also showing very, very similar and rewarding findings. So it's 12:30, and again, to be respectful for time, I'm going to jump right in now to the rice bran discussion. So again, rice, I mean, we know that billions of people around the world use rice as a staple in their diet. I mean, there's no question that humans have been eating rice for millennia. It has 3 basic components to it. You have the outer husk or hull that we can't eat. That obviously gets stripped off first in the milling process. And then the middle layer is where the real magic of this plant is. It's called rice bran. It's the middle layer. That's the layer that gives brown rice its color. Now, unfortunately, about 70 to 80% of the rice, I've looked up at these statistics, about 70 to 80% of the rice sold in the world is white rice. So the white endosperm, that big piece that's left over that we refer to as white rice, it still has a lot of nutritional value. But unfortunately, the bran is where all those magical polysaccharides reside. And so most of the world is actually not even enjoying the benefit. You know where rice bran normally ends up? It either gets thrown away or it gets fed to livestock. I mean, to me, that's just mind-boggling that the most beneficial component of this amazing plant is, for the most part, not eaten by humans. Now, I would argue that compared to what the doses and the amounts that we've looked at in our research, even if you're eating, let's say, a cup or a cup and a half of brown rice every day. I don't know about you guys. I eat brown rice, I don't know, probably 3 or 4 days a week at least. Some days I might even eat it, or some weeks I might even eat it every day of the week. But even then, you're probably getting just barely enough of the rice bran content in comparison to the doses that we used in the studies. Now, even though we're not talking about 20 or 30 grams, we're only talking about 1 to 3 grams per day. So definitely eat your brown rice if you don't. But again, in the context of how much you may need for a therapeutic or physiological benefit, that's where just getting it from food may be a bit debatable. And then there are other studies. These references are not from us. These are other studies looking at just generically what rice bran can do. Again, it is a total nutritional powerhouse. It has been shown to have well over 400 different nutrients, phytonutrients, elements, compounds, cofactors, metabolites, et cetera, that all have incredible healing benefits. And you can see in some of these different areas, especially in inflammation and immune function, where it's really doing its job. Now, this particular rice brand that Barbara introduced to me from this company in Japan that makes it. We ultimately started a relationship with these guys from Japan, and I still enjoy that relationship today. It's just been a very treasured experience to get to know this company and work with them. But we ran three clinical trials, and back again, you can see nearly 20 years ago when this all started. Um, the information that was published, or that was the science that was conducted in the United States, was a bit on the limited side. They obviously, being from Japan, had focused most of their money or their funding in either Japanese institutions or in some other parts of Asia. But nonetheless, as they were trying to grow their footprint in the United States, they wanted to expand the work here. So that's what ultimately led to us running these three clinical trials. And so the first one was with people with no type of chronic disease to our knowledge. These were assumed healthy people. And then the second one led to a study in HIV, and then the third one led to a study in non-alcoholic fatty liver disease. So I want to go through with you the highlights of this particular research, this track of research that again we've been doing all these years, and how exciting this potentially is. So the hydrolyzed rice bran, if you're curious what that means, so the stabilized rice bran is the type of rice bran you get it. That's the raw rice bran that gets taken from the rice kernel, and then you have this rice bran that's sitting there that needs to be stabilized because of the fatty acid content. It will tend to go rancid if you do not stabilize it quickly. And that's just simply making sure that it remains, moisture free and at a controlled condition in terms of the air. It's not anything very high tech, but the hydrolysis aspect of it is very fascinating. So what this company had figured out many, many years ago is that if you take shiitake mushroom enzyme, take the stabilized rice bran, hydrolyze it with the shiitake mushroom enzyme, and then it seems to change the molecule just a bit. It seems to lower the molecular weight just a bit, so it becomes even more of a potent signaler to the immune system than maybe just regular stabilized rice bran. And one of the things that we've been kind of, going back and forth about, I mean, again, because of the nature of these polysaccharides being so complex and it's again, you cannot even draw these things on a piece of paper. They are so complex. It's like a 5D structure essentially. But in looking at trying to help explain why it is that these things seem to be so connected to the immune system, one of the theories that one of the groups or one of the guys in the company came up with, especially because they have funded so much research, not in the United States, but again in Japan and other parts of Asia, in cancer, which we probably don't have time to get to today, but I'd be happy to come back and summarize some of that cancer information if you guys like at some point in the future. But the one of the interesting theories that somebody came up with is that cancer cells express these Celele Lewis X and Celele Lewis A. No relationship to me. I don't know who that Lewis is, but they express these types of determinants that it seems like the hydrolyzed rice bran may have a real affinity to, and that may be one of the reasons why these things are so, again, linked to our immune system, and why our immune system seems to respond to these things so well. So that's just kind of another working theory among several that we have. If we had a whole lot of money, we could we could spend more time testing some of these theories. But unfortunately, as we all know, clinical research takes a lot of money to do. So anyway, the first the first study that we ran, this was looking at comparisons between two different groups. One group taking 1 gram per day, and then the second group taking 3 grams per day. And because they had had, all of this prior work prior to meeting us, I mean, they knew very clearly that depending on the significance of somebody's situation, whether it was like a late stage cancer versus maybe somebody that just had a, mild metabolic dysfunction, there were definitely differences in terms of the effects expected based on either using 1 per day or 3 grams per day. So we thought that was an interesting way to split up this first study. And we only wanted to look at it for 60 days because, again, one of the key questions that we had was how quickly would the natural killer cells respond to taking the hydrolyzed rice bran? So we wanted to look at that in a relatively short-term period of time. And that was also the reason why we chose healthy people, because we wanted to see that actual action occur in healthy people, not in people that already had cancer or heart disease or diabetes or something. And then we looked at the changes from baseline, 48 hours, 1 week, 30 days, and 60 days. We got two papers out of that first study. One was basically all of the clinical data, and then the other one was a more mechanistic look at this flow cytometry and some of the techniques that were used at that time. So I had no, looking at this graph for the first few times, I didn't have the appreciation for it that I do now. And I wouldn't say it's as exciting as our ADAS cog finding in the Alzheimer's study by any stretch of the imagination. But certainly when I look at this now and I understand the concept of immunomodulation, which, if you're familiar with something that's referred to as an adaptogen, for example, like ginger, or some homeopathy treatments. Adaptogenic just simply means that, again, going back to our body's inherent intelligence, it has this capacity to either know when to turn on or when to turn off things, metabolic pathways, etc. And so, in our paradigm of trying to help explain again what was going on at the cytotoxic level with our natural killer cells, which, by the way, are our first line of defense against either virus or transforming cells, this graph is just so cool to me. And you can see in the blue, it's the 1 gram per day group. In the red is the 3 gram per day group. Now, statistically, there was no difference between the two groups, and probably for the company's sake, that probably wasn't the best thing they wanted to hear, because they would much like to have been able to say, yes, there was a statistical difference between the two groups. There was not in this study. And then also, if you look at that point at the assessment, where it peaks compared to baseline 48 hours and then the 30 and the 60-day time points, the statistically significant increase at 1 week was just so perfect for us. And I'll explain this why, because again, these are healthy people. So what happens? We give them the rice bran at baseline. You have a slight uptick in cytotoxicity at 48 hours. And then you have this statistically significant increase at 1 week. And so remember, these are healthy people. So the natural killer cells are ready. They're ready to fight. They're ready to look for virus or transforming cells. There's nothing there. Those are healthy people. So the mechanism shuts off and it goes back down, actually even a little bit below baseline at 30 and 60 days. So again, this for us was like true perfect immunomodulation, meaning that the rice bran signaled to the natural killer cells to get ready for action. But these were healthy people. There was nothing to do. Their jobs were not really needed at that time. And so the mechanism was shut off. So again, for us, this was just like such a beautiful graph to be able to show this. And then I really just kind of glanced over the TNF alpha and the VEGF findings from the Alzheimer's study, but these were very consistent with the Alzheimer's study, meaning that with using the rice bran, we could control that inflammation according to TNF alpha, IL-6, and then the VEGF, again, which I mentioned is commonly looked at in cancer and heart disease. Again, we could tone that down. And then the MCP1, that's a very interesting protein, this monochemotactic protein 1. That is actually a protein that the body uses to signal for a cancer threat. So you can see that it actually went up over the 60-day period. And all of these, again, once again, were not statistically significantly different between the 1 and 3 gram per day groups. But again, this just shows this overall picture of being able to lower inflammation, yet at the same time turning on that protein for cancer surveillance. So again, a very, very
I seem to have lost a connection. I'm sure he's going to come back on momentarily. Am I the only one who doesn't see him? Or has he just been booted off?
He
I
was
don't see him either.
Okay. Oh, thank you.
He disappeared for all of us.
Okay. Well, he just has to log back in. So me
The
text.
internet is playing tricks, probably.
Yes, as usual. It's likes to
Mhm.
play tricks on us. I
Yes.
will let him know in case I'm sure he knows.
Laura, just a question. Is this gonna be the presentation will be sent to the audience or
Yes. Yeah, we're recording it. Emily, right?
okay.
Yes,
Thank you.
I'm sending him the link again just in case he needs it. Pardon our IT issues. Oh, he's back. I hope.
stand by you guys.
All right, there you are. Hello. Welcome
Now,
back.
I had a power surge.
Oh no.
It totally kicked me out.
Well, welcome back.
Thank you. Sorry about that. Goodness. It's been one thing after another.
One of those days. Most interesting
Okay.
part too.
I'm sorry.
Most interesting part too of your talk.
Sorry about that, folks. Okay, can you see the screen?
No.
No?
No, Dr. Lewis, make sure you share the
All right.
at the
I think
bottom.
how's that?
Yes.
Okay. All right. So, I think I had just finished. Yes, I had just finished this screen. So I was just moving right along to say that the this first study with the rice bran was a perfect example of true immunomodulation based on the way the natural killer cells peaked, and then I didn't even go through all of we did a whole battery of cytokines and growth factors. There were 12 of them, so I only showed you four, but there were four others that also statistically changed, and then all of the liver and kidney markers, they were all normal, so there were no issues with safety as well in this study. Next is the NAFLD study. Just checking the time here. So this was excuse me, this was a 90-day study, and NAFLD, the reason they were interested in the NAFLD study is one of the groups in Japan had conducted a study in rats, and they used a model of liver injury with the rice bran, and it turned out to have a really nice effect in looking at how it modulated inflammation and actually shut off some of the key indicators of liver injury. So they thought, well, let's look at this in humans. And NAFLD is certainly one of these interesting from a conventional perspective. From what I learned as we were conducting the study, a lot of times people with NAFLD are just simply told to lose weight, and so the theory is you're overweight, your liver is fatty, and so as you lose overall weight, your liver will also lose weight. But of course, we know that a lot of the weight loss intervention studies in the literature, unfortunately, are not very effective. They might work in the short term, but then compliance becomes an issue and people end up yo-yoing or putting the weight back on. So, really, that was not exactly the best. That's not exactly the best advice to give to people who have a fatty liver. But anyway, we conducted this 90-day study. This one was a placebo control, and we felt like because NAFLD is one of the earlier, I mean, it's certainly not NASH, it's certainly not cirrhosis, it's not one of the much more severe liver diseases, that we only used 1 gram per day for this study. And then we looked at a whole host of different biomarkers to see what would happen in response to giving folks the rice bran. So here's the I don't know, most significant, maybe not necessarily, but certainly one of the key findings, ALP, one of the liver enzymes. You can see in blue, you have the rice bran group, it goes down over the 90-day period. And then in the placebo group, it goes up. And so obviously, ALP is looked at as one of the key enzymes to determine how well the liver is functioning. So this was a very nice finding. Again, that was a statistically significant difference. The eosinophils, these are also a component of our immune system that handles or modulates inflammation. You can see in the rice bran group, it's going up very nicely, whereas in the placebo group, it goes down. In the monocytes, again, these are another type of cell in our immune system. These are responsible for clearing out metabolic waste. You can see in the rice bran group in blue, it's going up. In the placebo group, it also goes up at 45 days and then it plateaus, but this was statistically significant. Now, I would like to point out, I didn't mention this actually before in the first study, when you looked at that graph of the natural killer cells, if that graph had continued going up, in other words, if it didn't peak at 1 week, but it continued going up, then we would have referred to that as immunostimulation. If the graph had started out at baseline and then just went straight down over the whole 60-day period, we would have referred to that as immunosuppression. Certainly in these short-term episodes or interventions, in the case where, again, in this study, you have people with a liver disease, our theory again was that you want a bit of immunostimulation. Sometimes people are a bit, I guess, nervous when they hear that term because they think, well, wait a minute, could you be potentially creating some sort of an autoimmunity situation? In this case, we say no, because again, the hydrolyzed rice bran is in a way kickstarting the immune system to start stimulating some of these repairs. So we don't actually, in like a 90-day, if this had been in other words, if this had been a 12-month study, like in the Alzheimer's and the multiple sclerosis studies, then we would have said, okay, yes, this is probably not the kind of immune response we want. We don't want stimulation for 12 months necessarily. But in a 90-day period, we thought this was actually exactly what the folks with liver disease needed to kickstart healing in the liver. In the neutrophils, neutrophils are known to secrete IL-17. This is a pro-inflammatory protein. They're also very important for preventing different types of infections. So in comparison to like some of that earlier rodent work that the company had done, this was actually very consistent with that. So, and again, it's a nice finding where you can see in the rice bran group, the neutrophils are going down over the 90-day period, where in the placebo group, they're basically staying the same. And then again, you can see that trend in that curve of the IL-17 as well. And then IL-17 is definitely a protein that should be looked at for anybody that has any type of liver condition because of its pro-inflammatory component. GGT, so I'm sure some of you are probably very aware, this is one of the most important enzymes for looking at overall liver function, particularly in the case of somebody who may be at risk for a much more advanced stage of the disease. So unfortunately, and this was probably due to our small sample size, this was not a statistically significant finding. However, we know that this amount of 50 international units per liter is deemed clinically significant. And look what happened here in our study. We got the rice bran group down below that 50, that key clinically significant threshold below 50, whereas the placebo group was pretty high and continued being high, well over that 50 level. So again, this was a really nice finding from a clinical perspective, not backing it up with statistics per se, but at least being able to say clinically, this was something very relevant. So overall, you had all these really nice findings. Again, it's a short-term study. We don't know what happened or what could happen beyond 90 days, but at least in terms of being able to help people with this disease kickstart the immune system, start to get that inflammation under control, and start to get some of these subsets of the immune system working in their favor, this was very significant. And then finally, in the third study that we conducted, this was in folks with HIV. We wanted to use 3 grams per day, again, giving a tip of the hat to the fact that people with HIV, they're taking these antiretroviral medications. So we know in the literature, it's very clear that you have the virus, you have the medications, and then you have the interaction of the two that's creating all of these very unfortunate side effects that's putting these people more at risk of different types of diseases, whether it's cancer, diabetes, or heart disease. And so one of the key components to this is that you have this overstimulation of the CD8 or the cytotoxic cells in relationship to the CD4 cells. And remember, I mentioned the really cool finding that we had from the Alzheimer's study looking at the CD4 to CD8 ratio. So here we thought we would look at the same thing in people with HIV. We would look at this CD4 to CD8 ratio. We would see what would happen. We know that in many cases of people with HIV, they actually have a ratio that's below 1.0, and that's where it gets very dangerous and very tricky. So 80% of the time when the medication is changed to try to help boost that value back over 1.0, it fails. So in other words, it only works about 20% of the time. And so we were curious to see if because of all the known inflammation and immune function benefits that the rice bran confers to people, if it would have any impact on that ratio in this study. And again, we looked at 3 grams per day of the rice bran compared to placebo over a 6-month period. So again, your CD4 cells are your helper cells. Excuse me, it's been, as we know, historically looked at for monitoring HIV status. You can see there's no significant difference here between the two groups over that 6-month period. You had about a 3% increase in the rice bran group, and then about a 2% increase in the placebo group. So again, nothing there really to hang your hat on. Now here is where it starts to get a bit exciting. In the CD8 cells, again, I mentioned that a lot of times these folks are having this overstimulation of their CD8 or their cytotoxic cells, the killing T cell type. And so look at what happened with the rice bran group. It goes down by about 5%, but in the placebo group, it's going up by almost like 58%. Unfortunately, because of how big the error bars are, you can't really appreciate the significance of that change just by looking at it graphically. You really have to look at the raw numbers. But again, this was a really cool finding to what, and this was statistically significant to what then happens in the next slide, which is just, again, one of these really cool, nerdy type of findings that, we as scientists can sometimes have the fortune to have. But then obviously, seriously, what this means for people practically and to help their lives is that look at what happened with the CD4 to CD8 ratio. Now, again, this was not statistically significant, likely due to small numbers in our study, but you can see that both groups at baseline are below that 1.0 value that I mentioned is very, very crucial. And then at 3 months, look what happens. They both go down, although the placebo group goes down quite a bit more. And then finally, look what happens at 6 months. Now you get the rice bran group in the blue over 1.0, and yet the placebo group continues to stay way down below that 1.0 value. So this 1.0 value, again, is considered to be very, very important for people with HIV to lower that risk of diabetes and cancer and heart disease. So again, this was probably the first time anything like this had ever been published in the literature, at least to our knowledge. I mean, we searched far and wide to try to find some other nutritional or some other dietary factor that would show something similar, and we couldn't find anything. So to our knowledge, again, once again, a completely novel and new finding to contribute to the literature. So really, really important here. I mean, I can't emphasize enough how much, if you look at the HIV literature, how keeping that CD4 to CD8 ratio over 1.0 is so crucial for those folks. And then again, helping that CD8 overstimulation problem not be as much of a problem with the rice bran is what ultimately and essentially we showed in this study. So as I mentioned, this particular nutrient has over, I think it's even more than 60 now. I mean, there are many, many studies and articles that have come out of those studies that have been published in the scientific literature over the last almost 30, this was early 90s, so 35 or so years ago. I mean, we're talking about an enormous amount of scientific information. And again, if you guys are interested in learning more about this at some point, I can do just a whole lecture just on some of these other things. And as I mentioned, most of this work has been focused primarily on cancer. So for those of you who remember from back in December, basically these conclusions about hydrolyzed rice bran are almost completely the same as for the aloe polysaccharide. In other words, they have this incredible immunomodulatory effect. it's almost like a balancing, right? And again, I didn't talk about it today in looking at like the Th1 to Th2 effects from the Alzheimer's and multiple sclerosis studies, where it really shows that the body responds to these polysaccharides by balancing those pro and anti-inflammatory components. And then all of this other work, some of these specific outcomes that we found related to whether it's the natural killer cells or the CD8 cells or GGT or some of these other proteins and growth factors. I mean, just really, really fascinating when you look at it this way. Again, like the aloe, it has no adverse effects that we're aware of. You can take it with anything else. There's no such thing as hypo-responsiveness, meaning that you take it for years and then all of a sudden your body says, well, I don't need this anymore, or you kind of develop almost like a tolerance to it. There's no such thing. So we're very confident in saying that we believe that just like the aloe vera, the rice bran has this incredible capacity to be immunomodulatory and essentially to signal to the immune system to correct whatever imbalances are going on at that time. So for us, like looking at how safe they are, how effective they are, just their benefit to human health is almost like anything else that I'm aware of in the plant kingdom, if you will, other than maybe curcumin. I mean, that's about the only other thing, and that's just not, by the way, the research that we've published here at UM. That's from many scientists and laboratories around the world looking at these polysaccharides as well. So again, they're just so beneficial. And when I look at what you can utilize in your toolbox, if you have your abstract health toolbox, if you will, and what tools you can put into those or in the slots in your toolbox as part of your health promoting strategy or your tools that you utilize. To me, these polysaccharides are at the top of my list. I know I take them every day. And again, there are no known adverse effects. You can take them with anything else you're taking, whether it's a medication or other supplements. In fact, as Dr. Reg and I have discussed many times, we believe actually, at least in the case of the aloe vera, that it actually has like an emulsifier effect that helps your body absorb some of these other nutrients that you take it along with it. And then again, maybe on the rice bran side, there's a bit of debate about how much you can benefit from if you eat brown rice every day. But in terms of the aloe vera, I mean, we have some aloe vera growing in our backyard, but I'm not out there every day, snipping leaves, sucking this nasty tasting gel down that's 99 point something percent water, because you'd never possibly get enough of the concentrated nutrients in it to have any real benefit. So in some nutritional supplements are, in my opinion, essential, again, because you can't get these things from food. And just the effects that we've published and showed are just really impressive to me. And then again, if anybody if came late or blinked out when I had that power surge, you can email me or call me if you're interested in either this presentation or the articles that we publish. But I'm just very grateful for the time to share with you guys today and talk about some of my journey and the work that my colleagues and I have done. And so thank you for your attention. I really appreciate this time with you today.
Thank you, Dr. Lewis. This was a really wonderful, inspiring presentation. Very
Thank you.
informative. You do
Thank you.
have a couple of questions in the chat box. They're asking about the supplements that you've been
Okay.
talking about with the aloe and the rice bran and how they can get those.
The best, if you guys want to go to my website, that would be the best general recommendation that I could make. Go to drlewisnutrition.com and you'll see the product, especially the formulation that we used in the Alzheimer's study. Excuse me.
So, okay. And they were also asking what supplements you take.
So in addition to the polysaccharides I take every day, I take a vitamin B complex. I think that's pretty important. I take magnesium. A lot of people are, as we know, unfortunately, not getting enough magnesium in their diet. I take a D3K2. What else do I take? I take creatine every day. I'm a big fan of creatine. I take somewhere between 5 and 10 grams of creatine every day. I think not only now is it known very well as a boost for your physical activity performance, but now it's being looked at as how important it is for brain function as well. So I'm a big fan of creatine. And that's really about it. I take like a multi-mineral that's got like, some things like zinc and copper and chromium in it. Um, I don't think that's, or I think that's, I don't think I'm leaving anything else out at the moment. I think that's about it. Oh, I take some EGCG as well, and I take some curcumin as well, actually.
So there's a question. Does the daily brain care supplement on your website, on your site, include the aloe dosage that you study?
Absolutely. Absolutely. So to make claims around any kind of nutritional, you really, if you're not, you could, I mean, you could make up anything you want, right? I mean, unfortunately, a lot of unscrupulous people do stuff like that. But to be true to the science, the product has the studied amounts in it. So yes, and the really fascinating thing about the polysaccharides, again, in comparison to say the average person eating, I don't know what today, 3,000 3,500 calories per day, you really only need like at most maybe a few grams per day of these polysaccharides. So we're talking, if you 1 gram of polysaccharide is 4 calories. If you took 3 or 4 per day, you're talking 12, 16 calories out of, again, the 3 or 3,500 that the average person eats. So it's really incredible when you look at it from that perspective of how little content the body responds to. I mean, it's just fascinating. It just all of this stuff I just totally find mind blowing. And still, after all these years of working with this stuff, it's still I'm every day I learn something new or somebody reports to me something that is going on, and it's been an amazing journey because again, most people they're not aware of these polysaccharides, right? Like it's like your grandmother probably told you, like I know mine did. I think both my grandmothers told me when I was a little boy and I got sunburned, hey, put some aloe vera gel on that. But does anybody really wonder why aloe vera does what it does? And then topically, I'm not saying there's anything wrong still with that purpose, but man, when you consume those polysaccharides, again, based on our research and a lot of others, that's where it's really just incredible. I mean, really just incredible.
So there's another question. It's 5 minutes after, so whoever, is it okay? Do you want to stay for a few minutes to answer more questions?
Sure, sure.
Okay. So how well are your formulations absorbed by the GI tract?
Well, we have not. So that's a great question. I mean, there's definitely the question of bioavailability, right? Like you have two components related to absorption. Well, absorption and bioavailability, they're related, obviously. So how much material you actually get into the system, and then the bioavailability of that, meaning how much of the ingredient, the active ingredient, actually stays intact. So refer to that as bioavailability. Unfortunately, we haven't had any funding to do any actual bioavailability studies on all of the different ingredients. But I mean, clearly we wouldn't be seeing all of these different effects downstream in the blood in all of these different immune and inflammatory markers if we didn't have a pretty significant level of absorption and bioavailability. What that value is exactly, I don't know, but I mean, there's no other way to explain that they're not getting into the bloodstream to some level if they weren't doing that, right? I mean, there's just what other explanation would there be?
That makes sense. And so there was another question about, so they were asking about rice bran recommendation, but I noticed on your site that there's a combination of the rice bran and the aloe.
Yes. So if somebody's interested in just the hydrolyzed rice bran, they can go to it's actually so one of the retail names is BioBrand, and they can go to Amazon. They can find BioBrand there. I didn't mention the name of the company just to be respectful of CME, but Daiwa Pharmaceutical is the name of the company in Japan that makes the BioBrand. It's not a pharmaceutical company. Their company started out as a distributor of pharmaceuticals in Japan, but then they shifted to creating dietary supplements. So but they didn't change their name. But But anyway, they can, if anybody's interested in that particular product, it's called BioBran by Daiwa Pharmaceutical, Daiwa Pharmaceutical.
All right, I'm writing that down just to check them out, just to see what they have. Very interesting. So yes, thank you once again for coming back for part 2 of your presentation. This is really fascinating.
My pleasure.
Any other
Anytime.
questions? Just not just, and a lot of thank yous. So all right, and they're looking forward to receiving a record. It's okay, still okay, right, for us to record?
Oh, absolutely. Hopefully that power surge didn't mess it up, but
Oh, I'm sure it's okay. So thank you very much, and we'll
okay.
see you soon.
Thank you, everyone. Have a great day. And let me know if you have any questions. I'm always available to help. I have no problem with people have other questions or comments later. I'm more than happy to help.
Bye,
Bye, everybody. Thanks for coming.
Okay. Thank you.